contact. Okay, give me 1 second. I'm going to the report. Please help in ल रूपकजीले ट्राई गर्दै हुनुहुन्छ एकछिन live त देखाउँछ okay so I think we're live okay looks like we're live it's not showing that is live but
waiting listener waiting room
okay wait I think we're a little bit यसो मैले त चेक गर्नुपर्ने हुन्छ so NRNA okay yeah I think we're live so please go ahead Dr. Sarita
okay good day everyone my name is Sarita Pandey-Bhattrai. I'm an ENT surgeon, head and neck surgeon in South Africa, based in South Africa. I'm also a co-chair of Global Health Committee of NRNA. Although it seems to be far and quite limited to the Central African at present, Ebola cases, virus infection numbers are rising slowly. And because we have Nepali diaspora that live in both Uganda and DRC, as well as Sudan, we hope to sort of arm the Nepalis that are living in those countries with the knowledge of this disease on prevention and possible management plan after should infection unfortunately occur. This event is in collaboration with NRNA and PHOMIR, which is Protecting Health of Migrants and Refugees. And this is an international organization which is dedicated to advancing health rights of refugees and migrants across the world. This webinar is streamed live on our official NRNA social pages. So please feel free to ask questions on the comment sections, and we will respond to you as we see the questions. As you all know, of all the 5 known strains, 4 strains infect human beings. And at the current, we have a Bundibugyo Ebola virus strain, which is causing the endemic at the moment. There's about 700 cases that have been reported to be infected, confirmed cases, with 138 deaths. I think 136 are in the DRC and 2 are in Uganda. It's very important because this Bundibugyo virus has no vaccine, and the treatment is purely symptomatic at this point. Today, we are going to review what we know so far about this disease, the challenges that lie ahead, and the actions that are needed to bring this outbreak to some sort of control. Once again, questions, please
volume बढाउनु पर्ला Sarita like very loudly त्यो अलिकति okay ठीक छ and ठीक छ you are fine like your volume हुन्छ
okay I can't go yeah. Once again, if you have any questions, please feel free to ask in the comments, and we will respond to you as soon as possible. If we need to, Nepali पनि translate on सक्छौँ चाहियो भने. Okay. The first speaker today will be Dr. Sanjeev Sapkota. He's a medical epidemiologist based in USA. He's a global public health professional with more than 2 decades of experience in disease prevention, outbreak response, and health program leadership across USA. He has worked extensively on the prevention and control of infectious disease with epidemic and pandemic potentials. He currently serves in leadership roles within the several international and public health organizations. Thanks, Sanjeev. Please carry on.
Thank you very much, Dr. Sarita. Am I audible? You can all hear me, right? Just wanted to make sure that you're okay. So let me share my slide. Let me see. Give me 1 second. Okay. Trying to share my slide. Okay. Good. Okay, I'm sharing. Okay, hold on. Let's see. Sharing बाकी बहने वाली बराबर बता. Live to stop. Okay, 1 second. Share. So you're the iron, eh? You're buying this. This is not sharing. Give me. I think we're having a lot of technical. Okay. MLA Dr. Sarita Lai. Give me 1 second.
What would you like me to do?
My slide share gonna like. I made you host, right? So I mean
Okay.
co-host. So you can admit people who as they come in. Bear with us. Windows. Okay. Yeah, I'm sharing my slide. Can you share? Can you see my slide, Dr. Sagar? You can see my slide.
I can see it has started.
Okay,
Okay,
good.
yeah.
Okay, good. So thank you very much, and really apologies for all the technical glitches, and thank you for bearing with us. So yeah, I'm really delighted to be here today and be presenting alongside other expert panelists, Dr. Sagar Paurel from Nepal. It's a pleasure to be participating in this webinar organized by NRNA and Protecting Health of Migrants, Immigrants, and Refugees, which is called FOMAID. Okay, the next slide I'm showing. Can you confirm, Dr. Sarita, that you could see slide title why this
Yes,
webinar is organized? You can confirm, right?
yeah.
Just okay, good. Okay, so why are we doing this webinar today? So Ebola virus disease is one of the deadliest infectious diseases known to humans. Although it is rare, it can cause severe illness and has a high death rate if not recognized and treated early. At the moment, as Dr. Sarita said, there's an outbreak of Ebola virus in several countries in Africa. While these outbreaks are currently limited to specific areas, we live in a world where people travel frequently and then they travel between countries. So, because of the international travel and population movement, infectious diseases like Ebola can spread beyond national borders easily. If we do not detect and control the virus and infection, it can easily cross the border and infect people widely. The purpose of this webinar is to provide accurate, science based information about Ebola. We'll explain what the disease is, how it is spread, and what symptoms are there for us to look for, and most importantly, what people can do to protect themselves and their family. This disease is now in some countries in Africa where there are many NRNA members and colleagues, and there is a potential that this disease, because of the transportation and travel, can go to Europe and Middle East and Asia. So before that happens, we want to give accurate information so that you are aware and then you actually take steps to prevent yourself and your family. So this is very important that sometimes there is always misinformation and there is fear about the disease beyond what they actually is. So it is important for us to get the accurate information. So our goal is to replace the myths by facts so that people can make informed decision and respond calmly and appropriately without panic and without fearing. We also want to empower individuals and community with practical knowledge. Okay, so a little bit of history. So Ebola is a serious viral infection that belongs to the group of illness called the viral hemorrhagic fever. Okay, the word hemorrhagic means bleeding. Although some patients, individuals who develop Ebola, they can bleed, but not everyone with Ebola is going to bleed. In fact, many people with Ebola will have high fever, weakness, vomiting, and diarrhea without obvious bleeding. So that is important for us to know. So Ebola actually was identified almost like 40 years ago, 1976, in a very rural country, the villages in Democratic Republic of Congo. And since this Ebola was the virus was identified near a river called Ebola River, the virus got its names as Ebola from that name, from that river. So Ebola virus belongs to the family called Filoviridae. Okay, the philo means thread. So the virus, if you look microscopically, it looks like a thread. There are other filoviridae viruses, including Marburg virus. So you may have heard about Marburg virus, which also falls in the same family as filoviruses. And then Marburg virus also causes similar symptoms. It also can cause bleeding. Okay. So other viruses in this family, filoviruses, like a thread, includes the Gyre virus, Sudan virus, Thai forest virus, Bundibugyo Ebola virus. You heard Dr. Sarita said Bundibugyo. So why this name is important is because this particular outbreak that is happening in Congo and Sudan belongs to this particular species, Bundibugyo. Okay, earlier viruses were Zaire virus, Sudan virus, but this virus is Bundibugyo. Why this is important? Because our treatment, vaccine, all has to be focused on Bundibugyo strain, the virus. If we have a vaccine that works for Zaire virus or the Sudan virus shown here, it's not going to work. So Bundibugyo is a new the virus strain that is circulating in Congo and other countries, and that is the important thing about that virus. Okay. So looking at this figure, you'll see that how the Ebola virus kind of transmits from person to person or from animal to person. So scientists believe that the natural reservoir of the virus is fruit bat. Okay, fruit bat is the bat which actually feeds on fruits. They eat fruit, and while they are eating fruits, they also transmit virus in the fruit. And when the humans come in contact with their fruit, they can get the virus. Another fruit bat virus related disease was Nipah virus, which was there a few months ago in Asia, Pakistan, Bangladesh. So we saw that virus. Also the Nipah virus is transmitted by fruit bat as well. Okay, so once the virus comes from the bat, it actually circulates among the animal kingdom, like chimpanzee get it, gorilla, monkeys, and other wild animal get it. But humans come in contact with these animals, right? Monkeys and others. And in Africa, there is a tradition called bushmeat. They eat bushmeat. They eat, like the meats from the apes, monkeys, and crocodile and others. And using those bushmeats and coming in contact with the bat and coming in contact with the fruits that the bats have infected, human can get the virus as well. So once one human gets the virus, goes inside the body, and then it actually the blood, the body fluids, saliva, urine, and other body fluids of human can be infected, and other human, when they come in contact with the body fluid, they get that virus as well. Okay, look at this map, and it is showing that since 1976, there has been many outbreaks of Ebola virus. So it's not only that today this time we're having this Bundibugyo virus. It was there in 2022. It was there in 2018 and 2020, and it was there in 2014. One of the largest outbreak was in 2014. This particular virus was also seen in 2007. So it's not in the new species. There was one in the other in 2000 and 1995. And on the left side of the slide, you can see the countries that were affected. Most of the Western Africa country, Congo, Uganda, South Africa, all those were actually affected by the Ebola virus since 1976. So again, look at this graph. Since 1976, there has been several outbreaks and people have been infected. The largest infection occurred in 2014. See, almost 30,000, close to 30,000 people were infected, right? And many people, more than 1,000 people died in 2014, almost 12 years ago. Many people might still remember that Ebola outbreak back then. Current Ebola outbreak, has infected around 700 people. That is shown in this graph. Again, as mentioned earlier, Dr. Sarita also said that so far for this Bundibugyo strain of the Ebola virus has infected, close to 700 people, and then there has been, more than 100 and 25 deaths. The cases and deaths were in mostly in Congo, but in Uganda we are also seeing some, cases there. Let's go back to 2014. So the Ebola erupted in West Africa, Guinea, Liberia, Sierra Leone. Then people who were working, from Europe and United States and other countries got infected, and they were treated, and then they get back, and then they were infected as well. So this current 2026 Ebola virus, now you can see on the right that almost like 700 people are infected, and then the people 138 people have died so far. So the case fatality ratio is 20%. So meaning that every 2%, if 10 people are infected, there is a chances that 2 people will die. So that's what's mean when it is 20% case fatality rate. And the countries shown in blue are low risk country because there's a chance travel the virus infection there is low, but still there. The country shown in orange have the high probability of getting importation of this virus. The country in reds are where the current outbreak is happening. And Dr. Sagar will talk more about it, but the common symptoms, as I said, starts with very vague, unconstitutional symptoms: weakness, headache, redness of the eye, and high temperature. Diarrhea kind of happens in the first phase. If the cases is severe, then the lot of diarrhea, bleeding happens, and then then people might die with several symptoms related here. So one question can come: why people with Ebola bleed? Okay, so not everyone bleeds, right? But some people bleed. Why they bleed is because is the blood, the way we all have the clotting factor in our body. It is called the clotting factor that is made by liver. So virus attacks that, the mechanism. The virus attacks the process of making clotting factors. So when there is no clotting factor, people bleed, and so that's the reason why people bleed. Again, not everyone with Ebola bleeds, but some do. But if they bleed, because the clotting factor is affected. Okay. So how do people with Ebola die? Again, as many people might think, they will die from bleeding and all those, but that is rare. Most people die from dehydration and loss of fluid and loss of electrolytes, and severe dehydration is what causes the person to kind of be in the risk of dying. Again, the virus triggers the immune response that damages organs, and severe vomiting happens, blood pressure falls, and kidney fails to work, and then if the Ebola is not treated on time, then people can kind of rapidly deteriorate. But the good news is Ebola can be treated. By treated means you can give intravenous fluid, IV fluid. If there is a lot of diarrhea, you can correct the diarrhea by replacing the fluid. And then if there are infections, secondary infections, bacterial infection, give antibiotics. So if you are treating the person, we don't have a vaccines yet for this particular strain. We don't have actual medication, but then all the symptoms, if you are treating, then there is a high chance the person will recover well. Okay, the people who die actually were not treated well, or they don't get the treatment on time, like diarrhea and then the fluid loss and all those, and it happens because of the lack of treatment. So how is Ebola virus detected and diagnosed? Like for every disease, there has to be diagnosis, right? So we know the corona pandemic, and the kind of influenza causes it. So we have to test it. So how we test is because is once a person is suspected of getting Ebola, then his blood sample is taken, and that blood sample is run into the lab, and lab does some sophisticated process called RT-PCR technique, and then they confirm or not confirm the person has the virus. Okay, so if it is confirmed that the person has a virus, then the person has to isolate him or herself, and then get treated on time. If you have high fever and you're not sure if you are infected or not, then there's always advisable that you get tested, right? Until tested, you have to isolate yourself so that you don't infect anyone. Okay, so that is the diagnosis. Um, Again, so what is going on currently about the vaccines against the Bundibugyo strain of Ebola? Um, I mean, one of the biggest challenges is there is no licensed vaccine as of now. Okay, people are trying to make vaccine. The vaccines for Ebola that is there is for the different strain called Zaire or Sudan virus. That particular vaccine does not work for this strain, Bundibugyo. But people are working to make viruses. So the organizations like University of Oxford, Moderna, CEPI, WHO are rapidly working on making the vaccines. And you may ask when the vaccine will come, and it could take anywhere from 9 to 12 months. So, and once the vaccine is developed, then that could be tried in people. But there's a vaccine development takes a lot of steps, and they have to be in quality control. So vaccine is not going to come out immediately, but they are working on the vaccines. In the meantime, we have to treat the patient symptomatically, and if you treat well on time, people can be well and soon. So again, until vaccine comes, we have to rely on the diagnosis. Once the diagnosis is confirmed, immediately isolate the person. Contact tracing, which means who the person who was suspected or confirmed from the Ebola were in contact, their family members, friends, who he talked to. The public health people, they try to locate people who are in contact with the suspected person. And then once they find this contacts, they tell them to watch their temperature, watch their symptoms, isolate themselves for some time. So that's what contact tracing is. But unfortunately, if the person has, the severe case of Ebola and they die, then we have to be very sure, ensure that the person is, buried or, or cremated, in a safe and manner, so that it's not infected, to others. I mean, in Africa, there's a tradition of touching the dead body and blessing the dead body, and that is one of the reasons why the virus can transmit. So in 2015, 2014, 2016, one of the main reasons of the rapid spread of the Ebola was family members and friends were touching the dead person who had died. So we would want to discourage that. For our Nepali community and population who are in Congo or Uganda, know the symptoms, know the signs, and make sure that you get information from the correct sources, and try preventing from getting in contact with people with Ebola. Again, if somebody or if you are infected, or if you are suspected to be infected, don't panic, don't worry. There is treatment there. If you are treated well with IV fluid, electrolyte, oxygen, manage shock, then you can, or people can get well very soon. There are several Ebola treatment centers in Congo. These are the places. Bunia, Risitu, those are, I don't want to read those, but those are operated by the different organizations listed here. Uganda, there are different treatment centers. Well, any hospital has the treatment centers as well, but these are specific for Ebola treatment centers, right? And some hospital may not take patients with Ebola, and they are transferred to the places where Ebola is treated well. In Kenya, the U.S. government is planning to build the treatment center, and you might have heard about that. The government was recommending that the U.S. citizen who are infected in Africa get treated in Kenya, and there has been some demonstration and a protest about that, but that is a different, the discussion. But right now, Kenya is also trying to, develop some treatment centers as well. So, is there a treatment for Ebola? Yes, but then it depends on which species, right? So, if you're infected with the Sudan or the Zaire strain, there is a vaccine. But right now, there is no vaccine for this Bundibugyo strain. But still, if you can be treated symptomatically. If you have a high fever, fever should be lower. If you are frequently going to having a diarrhea, you have to correct the electrolytes, and all those are there. Um, 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 right. So, what is the best way to prevent Ebola? Again, avoid contact. Know the symptoms. Know who if people are sick. If you don't know, then when you are going out in public, like in the countries where you're, like in Uganda, Congo, or other in Sudan, South Sudan, if you are there, be careful going into public places. Wear masks, and avoid contact with people. I mean, like not everyone will have the Ebola, but if you are going to the visiting people who have suspected Ebola, then take all the precautions, like wearing masks, washing hands. And how it is transmitted, it is not transmitted from the sneezes and the cough that is coming out. I mean, like in the COVID, it is transmitted from the body fluid. So if you touch the body fluid, like the saliva or the blood or other bodies, the specimen, the lab specimen, or the urine or other feces, if those body or the mucus, if that contacts, and if the skin is broken, then immediately wash your hand with soap and water for 20 seconds. Then contact the doctor or a health professional. Measure the temperature. When you are eating food, cook thoroughly, and stay informed. Talk to your health provider, and then watch the symptoms. If you're having fever, a high fever, then talk to your the doctor or provider, and then get guidance. Okay, so people with Bundibugyo are treated with again, like I said, no vaccine right now, but with the IV fluid, the oral rehydration solution, oxygen therapy. If it is severe, then you get admitted to the hospital, and all those things can happen. Public health actions, individual, you can contact, being prevent, you can prevent yourself by avoiding contact with the body fluid, going in contact with the person. Health, if you are a healthcare worker, nurses, doctors working in this, the high risk area, use for, the PPE isolation. The government is trying to do, the contact tracing. Their public health measures are happening everywhere. They're trying to, share the information. Those are there. Government is doing surveillance, so all of that are there. Okay. What to do if you are suspected of Ebola? If you suspect you have Ebola, know the symptoms: high fever, diarrhea, all those. Right. If you feel you have Ebola, contact the health professional immediately. Then stay home and isolate yourself until the incubation period of Ebola, which is 21 days. Okay. I mean, like mild symptom, like if you're confirmed, then that is a high likelihood that you have Ebola. Do not go out and infect others. Stay home and stay isolated places until you are free from symptom. Okay. Avoid contact with others. Always use soap and water for 20 seconds to wash your hand, because if you touch something that has Ebola virus, washing hands with soap and water can get rid of it. But wash it appropriately, properly, not for 5 seconds, but 20 seconds, like the same message that we're giving during the COVID. And if there are severe symptoms, do not hesitate to go to health facility and get the hospital's support. Okay. That is that. Again, thank you. Stay informed, and if you have any questions, do contact. Thank you, Dr. Sarita. So I'll hand it over back to you.
Thank you, Dr. Sanjeev. Yeah, very welcome everybody. The Pachialki Jirpat Anwako our audience Aruma. I think most of you are from around Congo and Uganda and Nigeria. Dr. Sunil Sapani Anwako Saile, global president. Doctor, Edendaily Boniface Anuvaina. So Wako topic, I think Dr. Sanjeev can it for now, more of the prevention and how to manage and Gornu. So I think we can move on to the next topic of Dr. Sagar's. Dr. Sagar is a physician and he's a public health specialist who is based in Nepal. He has experience with outbreak management and emergency response to disaster settings. He's played an active role in promoting disease prevention and public health measures during COVID-19 pandemic, and he has contributed to emergency preparation and response efforts in Nepal. Nepalको context he's shown his involvement in community by working in remote areas like Karnalis in the past before. So currently he's in Kathmandu, I think, Dr. Sagar. Welcome. Please present the topic.
Yes, I'm Kathmandu. Yes.
You're next, Dr. Sagar. You can go. Go ahead.
Can I give the option of sharing? Sharing option is not.
Yeah. Okay. Sorry, Dr. Sarita, did you give Dr. Sagar the option to share? Let me try. Okay. Yeah. So you have ability to share now.
Am I audible in my screen? Just to confirm.
Yes.
Namaste everyone. I'm Dr. Sagar Paudel. I'm a physician and public health expert currently working in Nepal, in WHO, the World Health Organization Nepal, in capacity of to support and strengthen emergency preparedness, response, recovery, international health regulation, disaster preparedness and response activities. Today, it gives me immense pleasure to be in front of you and sharing something about Ebola virus outbreak, which is of genuine concern worldwide, which is public health emergency of concern, which is declared a public health emergency of international concern by WHO. Dr. Sanjeev Sapkota sir presented on detail about what is Ebola virus, its cause, treatment, prevention, its symptom, everything. I think he covered many things, and I will be focusing on public health preparedness, risk communication, and lesson from drawn from COVID-19 disaster response. The topic which has been given to me seems that it is for the type of presentation is for a policymaker or technical person who are working on health. But I will try to make it very simple so that general public can be benefited by my presentation today. Thank you so much. Now I would like to move forward with the presentation. Now I would like to go. What is Ebola virus? Bundibugyo virus. I think Dr. Sanjeev talked detail on it. Just I would like to do in detail. In short, I would like to explain on it. It is very rare species of Ebola virus. There are many species. Which Dr. Sanjeev explained, and its case fatality rate is on previous outbreak it was 30 to 50%, and currently it is estimated to 40 to 50% case fatality rate. Case fatality rate in simple understanding is how much people die in 100 of the cases. For example, case fatality rate of 50 means 50 people out of 100 those who are confirmed case die because of this disease. So the case fatality rate is very high. In COVID, we had 1 to 3% case fatality rate, but in this virus, the case fatality rate is very high. No vaccine available till now for Bundibugyo virus, unlike Zaire virus, and limited knowledge because although we have very limited scientific data for this, and treatment option for this Bundibugyo virus is still limited, and no specific treatment yet. It is very more challenging. This outbreak is more challenging because there is no existing vaccine, limited treatment protocol, and there is urgent need for international coordination and support. Briefly coming to the timeline, in May 15 it was confirmed, and in May 17 WHO declared it as a public health emergency of international concern, and on late May it crossed the border. It spread over three provinces of DRC. I would like to quote CDC for the current data. As of in DRC, the Democratic Republic of Congo, till as of 11 June, the case might have been increased, but I would like to talk only on authentic data which is given by CDC. 689 are confirmed case and 139 deaths. Similarly, out of 689 confirmed cases, there are 139 deaths. That is a huge number. And in Uganda, there is 19 cases and 2 confirmed deaths, 1 probable death and 1 possible death. How does it spread? First of all, it spread from animal to human, contact with infected bat or wildlife. Similarly, there is contact between human to human, direct contact with body fluid, blood or body fluid of infected person. You can contaminate object, needle, like needle, bleeding, clothing used by the patient. Healthcare setting, there is a healthcare provider are at high risk if they don't use personal protective equipment, and it may spread during burial practices, traditional rituals, and even the virus can persist in semen for many months after recovery. But one thing is that it is not transmitted through air, water, or food. It requires direct contact with the infected person's body fluid. I'd like to go symptom and progression. Incubation period is 2 to 21 days, average 8 to 10 days. Incubation period means the time between entry of organism and appearance of first symptom. That is, it can occur between 2 to 21 days when organism enter into your body. And first symptom can be shown, it can be early at 2 days or late by 21 days. On average, 8 to 10 days is incubation period. In early day one, early symptom, it's like symptom is not prominent. The symptom might vary. Not specific symptom. In early symptom that occurs are febrile chills, muscle and joint pain, weakness, headache. In advanced symptom after day 5, it can have rashes on trunk and extremities due to bleeding manifestation, vomiting and diarrhea, internal external bleeding, multi-organ failure can occur if it is not treated on time. If we talk about recovery versus fatality, survivors recover within after 2 to 3 weeks with supportive care. Long-term complication also can occur for those who recover, like joint pain, vision problem, and hearing loss. And test fatality rate can usually occur within 7 to 10 days from disease onset. Other is preventive measure and protection measure, which has been already been talked by Sandeep Sapota sir, but I would like to briefly highlight on this. First, protective equipment like personal protective equipment for healthcare worker, gloves, face shield and ground, safe needle handling, and for infection control, direct contact, safe burial practice and disinfection tools, and education and awareness, community awareness, risk communication, and recognition of early symptoms, and maintaining isolation, quarantine, contact tracing, and safe transportation. Why it matters beyond Africa? Because it is limited in Africa, and it is not transmitted by aerosol, but by direct contact. So one might think why it is matters beyond Africa, because the global world, in this global world, there is large travel and trade. Due to large travel and trade, infected person can travel from one place to other place. So infected cases can be seen far away from outbreak zone also. Travel-related risk assessment entry protocol remain relevant for all countries, that even for Nepal also. Is public health emergency of concern is declared by WHO. All member states of WHO, 96 state parties of WHO, who are signatory of International Health Regulation 2005. It is their responsibility for surveillance, information sharing, and maintaining store capacity and support each other countries in prevention and response activities. Core pillar of outbreak preparedness. Just I'd like to go talk on preparedness now. It is the preparedness activities which I saw, which I'm predicting here. Seems like it is more upon for the policy maker and decision maker. Thus, I'd like to highlight in short about this. That is surveillance and early detection. Surveillance of cases. Surveillance means false fatal, means identify the cases, and early detection, which is through event-based, indicator-based coordination command structure. In Nepal and other countries, there are health emergency operation centers, incident management system. Similarly, health workforce and case management. Rapid response teams to be trained and IPC measures to be followed, and protection of healthcare should be done. Logistic and essential supplies, pre-positioning, PPE, diagnostic, medical countermeasures. Similarly, communication and community engagement, and One Health and cross-border collaboration, because cross-border collaboration is very important in case of Nepal, because Nepal is open border of India, And from international airport, the many passengers travel daily from Africa region also, and other part of the world. Just I would like to comment what is the preparedness which I talk for policymaker. Now preparedness start from us also. What is preparedness? What which we start for us, general public for us. We should know basic fact about Ebola. How does it spread? How it doesn't spread? We should know about the fact. Know all about early sign like fever, weakness, body ache, and we should not ignore any symptom. Those, especially those who are residing in outbreak area, prone area, neighboring countries, or especially after travel or contact, those who have contact with the traveler, they should not ignore warning signs like fever, weakness, body ache, etc. And everyone should keep emergency contact number ready for local health post, hospital, or health hotline of that particular country. Similarly, one should practice good hygiene habit daily. Hand washing, food safety, water practices. These protect against many diseases, not just Ebola. Also, it's thought about the COVID-19 has thought of this. And one should follow official update from WHO, Ministry of Health of that particular country, local health authorities. So one should not avoid relying on social media and rumors. They should not rely on media or rumors. Strictly follow on update from WHO, CDC, Ministry of that country or local health authorities. If advised by the health authority, one should cooperate for screening, reporting, isolation of case. If we cooperate with our health authorities, that will help to protect us and our community.
Dr. Sagar को froze भयो जस्तो छ. Okay, good. Connection, Dr. Sagar.
I'm working on it. While we wait for Dr. Sagar, maybe.
Am I audible? Sir?
Yes, now you're audible. Okay.
Dr. Sagar? I think Dr. Sagar has just left the group.
Yeah, we lost him. So yeah, we lost him. Yeah, maybe he's gonna join. Yeah.
While you're waiting for him to come back, Dr. Sanjeev, on your presentation there was one case reported in 19. So that case was actually not a South African patient. It was a Congolese doctor who was working in the Ebola virus zone, and he was one of the treating doctors. And he,
Okay. Okay.
he was
in South Africa.
He was confirmed. He was traveling from DRC to Africa.
Okay.
Yes, I'm.
Hello, Dr.
Yeah, please go ahead.
Yeah, so that
Hello,
yes, you are. Please go ahead. Okay, thank you, Dr. Sarita.
I was available in which slide? Can you confirm, please?
The slide was, I don't quite remember the slide, but you can
communication or preparedness.
Yeah,
preparedness.
Like yes, the preparedness. Absolutely. I think that's what it is. Yeah.
Shall I go with from this?
Yes.
Or shall I go with this? Yeah, preparedness starts with you. For the preparedness, which started general public should know basic fact about Ebola, how it spread, how it doesn't spread. Similarly, they should know about the warning signs. For example, sudden fever, weakness, body ache. Should not ignore them, especially after long travel or contact with some unwell. And always keep emergency contact number handy of local health post, hospital, or hotline. Practice good hygiene habit daily. That protects against many diseases, not just Ebola. Follow official update from WHO, Ministry, CDC, or local health authorities which are reliable. Do not rely on social media or rumors. If advised by health authorities, cooperate with screening, reporting, isolation measures. That will help to protect. Similarly, risk communication. What does it mean to us? During any outbreaks, health authorities will share regular updates. We should listen to those updates through radio, television, official website, and local health workers. It is normal for information to be updated as more is learned. It is not sign that authority hiding because we should wait for some information that is to be updated. We should not hurry and rely on misinformation or that has been posted by unauthorized person. If you have any queries or questions, you should always ask with the local health or post SPSG health worker or any concerned person, not rely on social media. Avoid forwarding photos, videos, fake news of any outbreak unless they come from verified sources. Speak to others calmly and factually. Rumor and panic spread faster than disease itself. So very calm and factually you should be speak. If someone in your community is sick or hesitant from affected area, support them. Do not isolate, blame or I blame or spread their personal information with them. We should always maintain their secrecy. With COVID, lesson learned from COVID-19, early and rapid detection of any diseases saves life. Delays in response allows to break outbreak to grow quickly. Clear, honest, and consistent communication build public trust. Confusion fuels rumor and panic. So there should not be confusion. So information should be clear, honest, and consistent. And communication should be consistent and honest. An strong health system like lab, hospital, workforce need source capacity to handle such sudden increase of cases. Community engagement and local leaders are essential for cooperation and behavior change. Equitable access to vaccine treatment, supply matters, gap even matters, gap leave everyone more vulnerable. Routine health service must continue alongside outbreak. Lesson learned for the general public from COVID-19 is act early, follow health advice quickly, help to protect everyone. Give trusted source only, stop panic and confusion. Wash hands, wear mask, stay home if sick, support each other, especially vulnerable people, help communities. Continue visit health center for routine checkup and stay calm and informed, which will help to both for community and health. For disease, learn from disaster response for the country, for policymaker country level, is that pre-positioning and supply of essential medication, clear command, coordination, structure that helps, and local community are first responders. So knowledge and partition are vital. Multi-other planning, for example, combining health, disaster security sectors, regular simulation exercise, flexible plan, and recovery planning should start early. A lesson learned from disaster response for public is be ready before disaster, knowing what to do before where to go. That helps to save lives. Local community often help, often the first to help, never should help others. And listen to local follow official instruction and practice. If there is any drill or awareness program, participate on this and actively participate and support. Only recovery takes time, so become patience and continuous support for affected people is very important. Every household can play a role by staying prepared and helping others. So these are lesson line from disaster. What you should know is for your risk, it is very low for the public outside Democratic Republic of Congo and Uganda. Virus require direct contact with body fluid, not transmitted through air, water, and casual contact. Higher risk for healthcare worker. Travel precaution, exercise precaution to travel affected area, avoid the contact with sick individual, maintain hygiene and practices, monitor symptom for 28 days after travel. If you develop symptom, take medical attention. Inform healthcare worker, provider of recent travel. Avoid contact with others until evaluated. Testing is available at major center. Follow that. Be aware of misinformation. Trust information from WHO, CDC, local health authorities, or reputed sources. And these are information which are shared by Ministry of Health and Ministry of Health and Food Safety in Nepal. This is Ebola रोग सम्बन्धी सचेतना कसरी सर्छ, प्रभावित देशबाट आएका व्यक्तिको लक्षणहरू, संक्रमण बस्ने के गर्ने, and there is hotline number for Nepal. We should follow such reliable information which are been released by Ministry of Health. This is an authentic information. And just coming to the end of my presentation, I would like to talk on key takeaways. Bundibugyo virus is rare but serious, which can have high fatality rate. No vaccine or specific treatment available. Now it is spread to Uganda and Congo, but and the risk to general public in other countries they are now low. International response is more mobilized and it is urgent. Early detection and supportive care are life-saving, and stay informed through official health sources. Thank you so much. Over to you, Dr. Sarita. If there is anything, I will be very happy to answer. And sorry for network issue in between. Thank you. Over to you.
Thank you, Dr. Cyber. I suppose technical errors are there, if not. Before we go to the questions and answer session, to summarize, basically, it is not an airborne disease. It's a rare disease, limited to Central Africa. It's a endemic in that area. It's not transmitted via cough, not airborne. So you can't cough or sneeze the disease like how COVID was transmitted. It is quite difficult to get unless you come in direct contact with the body fluids of the infected person. एउटा question आएको छ Mr. Vishnu Giriबाट. He is the president of NRNA in Congo. One question is, Dr. Saab, could you please provide information on what type of PPE is best to use and how to use it properly for protection?
Right, I can kind of jump in, and then Dr. Saar can fill in as well. First of all,